A very good morning to you. That is a worrying development, isn't it, if these numbers are being hidden behind TB and HIV?
Yes. Thank you. Thank you for having me on this program. And I also would like, on behalf of SAMA, to say a great thank you to all the healthcare workers out there, doctors, nursing staff, paramedical staff. Thank you. You are doing a great job. To come back to your question, yes, it is. And if I listen to the fact that it is from the TB and HIV as the primary diagnosis, it seems to me that it must come mostly from the public sector, and that can be a problem because your primary cause of death would be COVID-19 and your secondary cause of death would be the HIV and the TB. So the stats will be skewed.
Right, so we've got skewed stats potentially, but what we've seen is quite a dramatic increase, 50% infections, 50% deaths. Are we doing something wrong, or is this inevitable?
This is inevitable. We remember, I think there's a misunderstanding out there. The lockdown phase 5 was not to cure us from the virus, was not to eradicate the virus. It was merely to give the healthcare sector time to prepare for what is going to happen. I've said this many times before. We are now going to enter the eye of the storm. I have said before, we're not there yet. So now we're going to start going into this pandemic. Also, please remember, the stats that we are currently seeing is still coming from the lockdown time, because you always look back for around about to the past 2 weeks. So if you look at the past 2 weeks, this increase is part of the level 5 lockdown. So clearly, we can't really go back to the lockdown phase 5 because the increase is happening during that time.
Okay, Angelique, I want to ask you something about that makes me feel sick. The deaths of 3 children in New York of inflammatory complications, possibly linked to COVID-19. I know that there's been concerns raised in the UK ahead of this, and that this has changed, obviously. I mean, it's a completely different chapter, it's been called, in this disease, which was respiratory mainly, but we're now seeing different symptoms in children. What's going on there?
This is a difficult one because they are still looking into it, if I can put it like that. And this is an observation that's been made, and there's most probably a true observation, but there still need to be a bit of research into this, and it can be linked to immune systems. That if the child didn't had COVID-19, it would never have happened to this child. So, but because the COVID-19 actually left out the problem in the child's specific immune system in that regard. So there is a lot of on the media regarding what is happening with these children. But again, it's not if you look at it, it's only 3, maybe, let's say we're all wrong and it's about 10 children across the world. Yes, it's something that should not happen. But
okay, let me ask you very briefly about testing. Are we doing it correctly? There are some who feel that we should rather be focusing on those people who have been affected and then trace it from there, rather than doing these random mass tests. What do you think?
SAMA, the board of SAMA discussed this over the weekend, and the feeling is that we should rather have the patients, as they come into a healthcare facility with symptoms, test them, and then from there go and look for trace the contacts. The problem that you're having by just going out and testing is it's very costly. What are you going to do if the patient tests positive? You're going to move on. You're going to maybe look at the tracing some of the patient's people close to the patient. But the patient that is really going to give you a problem is one that comes into the hospital setup. So what happens currently is that they call them now people under, or a person under investigation. So The real cases, there was concern raised, especially from KwaZulu-Natal side, where they're saying that these patients now in the hospitals themselves are having to wait 3 to 4 days for results while everyone outside is being tested. So we need to focus our testing more at sites where you are seeing the patients coming in positive than just going out and starting to test nilly-willy.
That makes sense. Always good to talk to you, Angelique Coetzee.